Hello, everybody. I'm Dr. Anil Kamath. I'm a senior consultant surgical oncologist here at Helios Cancer Center. Now, May is Bladder Cancer Month. So, I'll take this opportunity to make you all aware about the signs and symptoms of bladder cancer and how it is diagnosed and how it is treated. Bladder cancer, fortunately, is not a very common cancer. At the same time, it's not so uncommon also. Every now and then, you do come across patients with bladder cancer. It is one of the major causes of death, as it is an aggressive type of cancer. Like many other cancer, bladder cancer is directly related to smoking. There are other risk factors, especially industrial exposure to certain dyes. How does a typical bladder cancer patient present? Now, usually it is a patient in the older age group and it presents as painless hematuria. So the person sees that there is blood in the urine and there is no pain associated with it. So this is a typical presentation of a bladder cancer. I do not want to give the impression that every patient passing blood in the urine has bladder cancer. This is because it can happen due to other reasons, especially urinary tract infections. But passing blood in urine requires medical attention, and you do have to get yourself evaluated if you have these symptoms. So, if anybody has this painless hematuria, what are the tests which are done? Now, regarding the other symptoms, they are less common. When pain comes in, usually the cancer is in more advanced stage and infiltrating the nerves. And sometimes bladder cancer presents as metastasis to the liver or lungs and other areas. So, if any patient has got painless hematuria, how do we investigate? Of course, we do the routine tests like urine examination, see if there are any malignant cells in the urine, do urine cytology, and do an ultrasound examination as a preliminary investigation to see if there is any tumor in the bladder. But the test which gives us definite diagnosis of bladder cancer is a cystoscopy. This is usually done by the urologist, and a scope is passed through the urethra, and direct visualization of the bladder is done. And if something suspicious or some tumor is there, then biopsies are done. And these biopsies are sent to the pathologist, and the pathologist confirms whether there is any cancer or not. So, if there is a diagnosis of cancer, then how do we proceed next? Next, we have to do the staging investigations. We may opt to do a MRI of the pelvis and a PET scan to see how much the cancer has spread. So, say a person is diagnosed with bladder cancer. How is he treated? So, broadly, there are two categories of bladder cancer. One is one which is not invading the muscle, and one which is going deeper into the muscle fibers of the bladder. The tumors which are not invading are called superficial bladder cancers. These are usually treated by transurethral resection. The procedure is called TURBT or transurethral resection of bladder tumors. The cancers which are more invasive or going into the muscle fibers, these are the ones which require surgery. And surgery, most of the time, would mean removal of the entire bladder, a procedure we call it as radical cystectomy. More and more now, there is use of chemotherapy before surgery, a procedure we call as neoadjuvant chemotherapy. And cancers which are metastatic, which have spread elsewhere, are usually treated with palliative chemotherapy. And here, cure is not possible. So, what I want you all to take home, or the message which I want to convey, is that we have to be aware of the symptoms of bladder cancer, especially painless hematuria. Smoking is a risk factor, and the treatments I have outlined as before. Thank you.